Hi, so our project is on the bubonic plague, and it's by Emma Harold and Ryan Brokmarkle. Emma Harold slides are going to say E, and Ryan Brokmarkle's are going to say R. Okay, so first off, the description of the bubonic plague is it is believed to have originated from China in the mid-1300s. The bubonic plague spread along trade routes and reached Europe around 1347. When it hit Europe, it killed roughly a third of the continent's population. Some would estimate around 25 million people. So, through the implementation of quarantine, the plague naturally subsided, kind of like we're in right now. With modern technology, in 1947, a cure was found for the disease. It is now easily treatable with antibiotics such as streptomycin, gentamicin, doxycycline, or ciprofloxacin. These antibiotics have lowered the mortality rate to 11%. So, the bubonic plague is an infectious disease caused by the bacterium Yersinia pestis, also known as Y. pestis. Yersinia pestis is found in small rodents and their fleas in rural or semi-rural areas. The disease is transmitted through the bite of an infected flea or exposure to infected material through a break in the skin. It cannot be transmitted from person to person. The symptoms include swollen, tender lymph glands called buboes. If the disease is left untreated, the bacteria can spread throughout the bloodstream and infect the lungs, causing a secondary case of pneumonic plague. So, for the pathogen itself, it is called Yersinia pestis, as we discussed in the last slide, Y. pestis. This pathogen can cause 3 different types of the plague. The most common form is bubonic, which is what we're studying. Each form has a different way of transmission into the body. For bubonic, Y. pestis enters the body through a break in the skin via a flea bite or an abrasion. Down here, it is a flea bite, as you can see. So a more serious but less common form is the pneumonic plague. This disease affects the lungs and is transmitted when a person breathes in Y. pestis particles in the air. So to the right down here, that is an example of the pneumonic plague. So, unlike the pneumonic plague, the bubonic plague cannot be transmitted from person to person. The second most common form is the septicemic plague. This develops when Y. pestis bacteria spread throughout the bloodstream and causes a blood infection called septicemia. So, how is the immune system involved in this? The pathogen, Yersinia pestis, is so destructive because it cuts off a cell's ability to communicate with other immune system cells needed to fight off the bacterial invasion. It easily bypasses phagocytosis and uses macrophages as an itch. Some of the bacteria is killed off by neutrophils, which are in the early line of innate defense. But those that survive replicate. The pathogen spreads to the lymph nodes, where they remain extracellular in the bubo. This is where the bubonic plague gets its name. These swollen lymph nodes are found in the groin, armpit, or neck. The buboes are very painful, swollen lymph nodes that develop quickly near the flea bite. For example, if you were to have gotten bit by a flea in the leg, then your groin lymph node would swell a lot. So, same with the armpit or the neck. If it's around the arm, it's armpit. Around the neck, it's the neck. So, if it's left untreated, the disease could potentially enter the bloodstream, making the disease extremely fatal.
These are the signs and symptoms. The bubonic plague affects the lymph nodes. Within a few days of exposure, you will experience flu-like symptoms such as fever, headache, chills, weakness, swollen or tender lymph node glands, resulting in swellings on the groin, under the armpit, and neck. Some get to the size of an apple or an egg, some bigger, some smaller. Blood and pus seeps out of these swellings. If untreated, the infection can spread to blood or the lungs. Boom. And now the video will be played. These are the diagnostic tests. Diagnosis is confirmed from identifying the Yersinia pestis organisms in a sample of blood sputum or lymph nodes from the patients. Diagnostic tests rely on culturing the organism, demonstrating the surface proteins of the bacteria, or identifying genetic material of the bacteria. Tests to identify the body's antibody response to the infection are also available. The prognosis of this disease is that 50% of people with the bubonic plague will die if their illness is not treated. The earlier the antibiotic treatment is given, the better chance for recovery. But with proper treatment and antibiotics, your chance of survival goes up to over 90%. But this plague disease is very serious and is often life-threatening without proper treatment, so make sure you get proper treatment. This is how you get treated. So during the Middle Ages, there was not much medicine at all, or many treatments that worked. The most common treatment back then was to put leeches on the patient and have the leeches suck out the diseased blood. Nowadays, we have developed from medieval medicine. If you have been in an area with the bubonic plague and are experiencing symptoms, you must go to the hospital immediately. There, doctors will run tests of blood or fluids to check for plague germs. Antibiotics are effective for treating the plague. You will receive either streptomycin, doxycycline, or ciprofloxacin. You will become very ill with this disease and may require additional oxygen, respiratory, and medications to maintain normal blood pressure. Patients who have the plague must be isolated while in treatment to avoid spreading the infection. There is one experimental treatment using the drug gentamicin. Gentamicin is supposed to give less harsh side effects than the other antibiotics, and it does the exact same thing. This is how you prevent yourself from getting the plague. So there's currently no vaccine for the plague in the United States. So if you're in an area where the plague occurs, you should take these precautionary steps. It's basically all in the West, and mostly in Colorado, New Mexico, Utah, and Arizona, and then some on the coast. So these are the steps you should take if you live in any of those areas and you have been exposed. So you should avoid picking up or touching dead animals. Use insect repellent to prevent flea bites. Treat your outdoor pets for fleas regularly and avoid rodent droppings.
Incidence, prevalence, and mortality. The bubonic plague is found in more rural areas of Africa, Asia, and the United States. Yeah, the United States. I thought that was weird too, but we do have the plague. So today the plague occurs in fewer than 5,000 people a year worldwide. So not a lot at all. The United States only sees about 7 cases a year, ranging from 1 to 17, estimated about 7. The disease is spotted in more southwestern states such as Arizona, California, Colorado, New Mexico, and Texas, where wild rodents carry the bacteria. With antibiotics, it has brought the mortality rate down to 11%. The most recent case spotted in the United States was in August 19, 2020. The man was a resident of South Lake Tahoe, California. This was the first case in California since 2015. And there's been a lot like this, like in July of 2020 is when Colorado saw their first case again. So they kind of range. Down here is a map of the United States and some cases that have popped up. I think that was in 2018. So cases that popped up in 2018. So to the right is just cases worldwide. But Ryan's were excited. So quiz time. I came up with a question. When discussing the bubonic plague, how does the pathogen, specifically Yersinia pestis, enter the host? Peace out!